throughout Cameron County, responding to an increasing number of people asking to be tested for the Zika virus. The CDC issued a travel advisory for Brownsville following 5 confirmed locally transmitted cases. Channel 5's Daisy Martinez spoke with a local health provider who is keeping up to date with those changing recommendations. Daisy?
Health workers at community clinics are seeing the rise in patients coming in asking to get tested for Zika. Now county officials are doing what they can to ensure that doctors are keeping up with the changing information. A packed Cameron County clinic in Harlingen has health providers hard at work. Ashley Person is 16 weeks pregnant with her second child. She's getting tested for Zika. She submitted samples that will be sent to the state lab for screening. The CDC last week issued a travel advisory for the city of Brownsville, recommending all pregnant women that traveled there get tested. Person is from Harlingen and tells Channel 5 News she has no intention of going to the nearby city.
It's really scary because that's something that will change my baby's entire life and my life. You know, it's not worth it to go there. It's just not.
The increase in concern is also increasing health providers' workload. Nurse practitioner Yvette Ortega tells us besides the everyday patients, at least 15 pregnant women also visited community clinics just today for Zika testing.
Every day there's new information. I mean, I get up in the morning and I look at texaszika.org to see what's new. Is there a new protocol they want us to do? Is there new guidelines to talk to the patients about? So I guess for the practitioners it's difficult because since it's changing so rapidly, then you know, you really don't know what I was doing yesterday is not really what I'm supposed to do today.
Cameron County Health Director Esmeralda Guajardo says that's why Cameron County health officials are doing what they can to stay ahead of the virus. Doctors from across the valley gathered in Rancho Viejo to review or learn about what symptoms they should be looking out for, who needs to get tested, and how to properly take blood and urine samples, and how to correctly fill out the necessary paperwork.
It's one of the things that I always push for is that we need to be more proactive as opposed to reactive. And so now that we know that we have Zika in the community, we need to make sure that we move forward in a proactive approach, even though it's already here.
Ortega admits the constantly changing information and additional workload is overwhelming.
I mean, they're frightened and they're concerned. They're very unsure of what's happening, and so we want to be able to provide them a little bit of information while they're here too, because they have questions that they want answered.
As researchers find out more about the virus, health providers will have to continue to make the necessary adjustments. The paperwork for submitting the blood and urine samples is one of the newest aspects for doctors, but county officials are urging doctors to take their time and make sure they fill out that paperwork properly in order to prevent any delays. They're also sending patients home with a bag of this that contains some repellent informational brochures and also some contraceptives. So these are the patients that are going home with this that are getting tested for Zika. Live in Cameron County, Daisy Martinez, Channel 5 News at 6.